Let's talk about why blaming your core for pain and movement issues is such a bad idea. I'm Jay Weitzner. I'm a certified muscle system specialist here at Symmetry Exercise Clinic in Naples, Florida. Let's go. The term core is a marketing term. That's what it is. Let's call it what it is. That's what it is. It's a marketing term. And the reason I say that is because we know all the muscles in the body. We know what they're called. We know what they do. But I guess the idea is that if we kind of use those words, they sound complicated and foreign to people, and there's a better chance of connecting to clients and exercisers if we just use the term core instead. The issue here is that it's led to a lot of confusion, not just for exercisers, but for some practitioners. I think giving them a false confidence and a false understanding of what's really going on. So let's explore that. Here's the first thing we really need to address and explain. If you were to ask anyone what the core is or where it is, you're going to get a variety of answers. That's going to depend on who they are, who they heard it from, what career they're in, and where in the career they are. So let's discuss it. Core, what is it? If you ask a lot of people, most people will say it's kind of here, it's this area. So then we really need to say, hey, what is this area? How high is it? How low is it? How much to the sides is it? Is it to the sides? Does it go to the sides? Does it go to the back? Where is it? Remember, if you're giving these general answers of it's around here, there's really just very general applications of those answers, right? We want to get really specific answers so we can have a really clear understanding of what's going on and how it may be influencing what's going on with you. So let's look at it. Let's look at like the first muscle that people think about often when they think of core, because they're thinking about a location, right? So they often think about the group of muscles that kind of run this way, this muscle called rectus abdominis, whatever. Names don't really matter right now. But this group of muscles, these, right here, these muscles, they'll generally pull you forward, and they play a role in in allowing you to go backwards, right? And those muscles also play a role in bending you side to side. They also play a role in how much they allow you to be twisted from one way to another. So that's kind of interesting. This one set of muscles does a whole lot of stuff. Then remember, you have to ask, do those muscles extend to the side? Because you've got these other muscles, obliques, people have heard of them, internal and external obliques, and they run like this, and the other ones run in the opposite directions like this. And those muscles, if the one here, the ones here, and the ones here, if they work together, they do this too, and they do all the same things that the other ones that I mentioned earlier. And the ones running in the opposite directions, if they work together, they also do the same things that this one does. If they work separately, this one with this one, it can also flex you, but also rotates you. And the other one's the other way. There's a lot going on. And these muscles, when you get off to the side, they don't run so diagonal anymore. They start running more vertically. So they play more of a role with this side bending thing. But remember, the ones in the front, they also play a role with side bending. So then we start to spin you around to the back, which some people may or may not consider core, depending on who you ask again, right? We don't really know. And these muscles, they're going to run from like your head down to your tailbone, and a whole bunch of different ones that cross different segments, that run at different angles, and they play a huge role in pulling you backwards or allowing how far or the rate at which you go backwards. And they also play a role with side bend. They also play a role with rotation. So you see, all of these muscles really work together, and there's a lot of overlap in what they can do. So, is the core a noun? Is the core a muscle or muscles? Is that what people mean when they say core? They're talking about specific muscles, because they should just say which muscles, because as you can see, some do some things, some can't do other things. So we're talking about extending the spine, or we're talking about flexing it. What are we talking about? So that's important. The next thing is this. If we're talking about movement, because the movement seems to be really associated with the muscles, right? The muscles are the things that move you. So if we're talking about movement, and whether it's bending or twisting or bending to the side, if we're talking about movement, let me ask you a question. Is your core in your armpit? Would you say it's in your armpit? You're probably going to have a difficult time finding a professional that would say, yeah, your core is in your armpit. Well, hold on a second though, because if core is not a noun but a verb, if the core is the bending, the twisting, the bending, if the core is the movements, well, you guys have all heard of like a lat muscle, right? It's that big thick muscle that's on both sides of your spine, and it's like this big thing. And not only does it help with pull-ups and pull-downs and rows and all that kind of stuff, but it also can side bend you. It attaches to the spine. It can also rotate you. It can also extend you. So if that lat muscle crosses your armpit, then I guess your armpit is your core, right? And by the way, what if I grab this bone and I said, is this your core? This bone, is this your core? This one? Well, the lat I just mentioned, it attaches to this bone. So does that mean your core is your arm? So does that mean when I do rows, pull downs, that I'm working my core? Well, this is getting confusing, right? This word core really muddies the water. Let's do this again. What if I grabbed the leg, this is the thigh bone, right? That leg, and I said, is this your core? Is this your core? Kind of like the arm thing we just went through. You've got muscles that attach from your spine to this bone. Same deal, right? They play roles in bending and twisting and same deal. So is your core in your hip? Is your core your hip joint? Is your core your leg bone? What? Where is it? This is just the tip of the iceberg when it comes to the problems with using the word core. And when we do this thing where we try to blame core for pain and movement issues. If we don't even know what core is, if people are saying, you have pain because of a weak core, you have back problems because of your weak core, you need to strengthen your core, that's almost like saying you have back problems because of your body. There's a problem with your body, you need to strengthen your body. It's just way too general. It's way too general. We need to stop using the term. Throw it away, get rid of it. In fact, use it as a red flag, as a warning signal. If you're dealing with a professional that's talking about your core as your problems, and if their recommendations to help you is something with the core, just respectfully turn around and take off and find someone else, because this isn't about them being a good person or anything else. This is just speaking to the current level of understanding of a body and your body and what's going on. So be your own advocate and look for a better solution.